My dear colleagues and friends, I would like to very quickly update you on some of the developments in light of the fact that the United States have approved a new antiviral agent, remdesivir. First, I would like to start with the treatment and management aspect of coronavirus 19 or COVID-19. We all know by now, as we mentioned earlier, but now it's more confirmed by big numbers, that the majority of patients would have either a pre-symptomatic, asymptomatic illness or actually a mild symptoms. And these would constitute around 84 or 85% of the total. Most of those, more than 50% of those actually are asymptomatic without symptoms or pre-symptomatic. The rest, another 30% of the total, is actually mild symptoms. Now, there is a subset of people, around 14%, really would come with the 14 to 20% would come with severe pneumonia. And these patients are really that they really need treatment. The others, they would recover on their own, and they need hospitalization and treatment. In this study in remdesivir, which is an antiviral agent previously used to the treatment for the Ebola, the remdesivir was able to decrease mortality from 11.6% to 8%, which is almost a 35% reduction in mortality. Not significant, but bordering on significance, and also significant improvement in the clinical outcome, which is that is improvement, quicker improvement with remdesivir. This is a very important milestone because this is on more than 1,000 people from 68 centers around the world, Europe, Asia, and the United States. And I believe this is a milestone because the data is much better than what we've seen with hydroxychloroquine. With the use of the plasma, convalescent plasma, which is having some promising results, I think we are making good progress when it comes to treatment. The hydroxychloroquine azithromycin combination is a big question mark in light of the studies not confirming that combination. So remdesivir with convalescent plasma, I think, is going to be the name of the future, the part of the future. And in patients who are intubated, possibly tocilizumab if used appropriately. So this is a concise thing about treatment. I would like to talk to you a little bit about prevention. In places where they had strict physical distancing with masking and the other measures, things worked, but the problem is it's not sustainable. For example, it worked very well in Singapore, South Korea, in other places around the world, which is phenomenal, including in New Zealand and also in UAE and Jordan. But the problem is, what do you do with the economy? And now in places where they're starting to opening, you might get some resurgers. In Singapore, they've seen resurgers. So this is a crude way, and the problem is, what do you do with the economy? It's going to ruin the economy. So it's a struggle. The vaccine, unfortunately, it will not be available until a year and a half or 2 years, if ever, because HIV, we've been trying for now 39 years with no success. So not much hope there, but there are some trials for the vaccine. The best ally now is that it might end up being seasonal, because the high temperature seems to be able to kill the virus, particularly on physical surfaces on the outside. A temperature above 27 degrees centigrade or above 80 would minimize the presence of the virus, and this could be our best ally. Thank you very much. I'm sorry I had to kind of put it in a very concise summary, and I will follow up with you. Take care.